Hi guys, now that we've already done our pre-procedure and prepped our skin, we're going to go ahead and get started. Go ahead and do our hand hygiene. Okay, you're going to grab some gloves and go ahead and clean off your scissors. So in your set, when you open up the kit, you're going to have a few different things. It's going to come with the actual drape itself, and it usually comes with 2 sets. So one is going to be the barrier, and then one is going to be the overlay. It actually comes with the foam and the suction tubing and the ruler. So based on your facility protocol, you're going to want to measure the wound size and record according to facility protocol. So first and foremost, we're going to go ahead and start by cutting the foam. So you want to grab your gloves. So there's a few different ways to do this. You can get as precise as you'd like. So you can actually start by measuring your wound, which we're going to show Mr. Jones over here. So some people like to measure the wound. So you got 1.4 by 1.6. Some people like to do that and then go ahead and measure it according to those measurements, or you can just eyeball it. Okay, so now that we're getting closer to our wound size, we have to be a little bit more precise. So these edges, you want to make sure there's no loose pieces. Of course, that's a risk for infection, especially if those little things get caught and we don't get them removed. And you also want to make sure if the wound has any type of tunneling, or if you're having to pack it with more than one piece, you record in the documentation how many pieces you used. That way the nurse that's changing it after you can make sure all the pieces are out. Here's our final foam. So since this is our barrier and it's clean, we can put that there. So that is step 1. Now step 2 is actually doing our drape. There's a few different ways to do this. Some people like to cut smaller sections and actually frame the edges of the border. And some people like to just measure the size of the wound. So you want a good 2 to 3 centimeters of surface area on all sides of the wound. So some people get as precise as getting a Sharpie and or a pen and just drawing the shape of the wound and then cutting it from there on out. Remember, we can always make this bigger if we need to. And you want to make sure the 1 is on the bottom when you're measuring the wound, because the way you're going to put the dressing on, if the 1 is not on the bottom, your measurements are not going to be accurate. So just make sure the 1 is on the bottom, and then okay, so I would say that's pretty precise. So now we've got our first layer. We've got it framed. So we're going to go ahead and take off the tape so we can secure that. You want to make sure the main thing is that you do not get any air. So precision is key here. And of course, you're going to have a trash can handy. This tape is very sticky. So it likes to stick to your hands and fingers more than it does to the actual skin. And of course, we've already put skin prep, so that's really going to help in this part, in the adhesion. But you can, the best thing I would recommend is starting on one side and sort of eliminating any air along the process by pressing down. So, like that. This is the key. I mean, if you have any air here, your suction is not going to work. So really take the time to get all the air out. And of course, it's easier on a person as opposed to a mannequin because there's no resistance here, but the skin surface will help this. So now that we've got the first number 1 removed, we're going to take off number 2. And keep in mind, KCL is the largest provider of wound vac, so the equipment that we're using is most likely what you're going to be seeing in most hospitals. So it's nice to sort of see how the taping works as well. We've taken off number 1, so here's step 2. All right, once again, just go ahead and reinforce. No leaks. So far, so good. And This is the last step. The blue part of the tape always comes last. And like I said, it likes to stick to us more than it does to the patient. Pull this taut. Get a good seal on there. Reinforce as needed, not a problem. All right, there is our drape. Okay guys, one thing I will say before we move on, I've got an air bubble, so let's go ahead and get rid of that. Otherwise, that's gonna affect my suction. And you could just take off the film. Remember, it doesn't have to be pretty, it'll still get the job done. And there we go. Free of air bubbles, free of leaks. All right, so now we're going to go ahead and get our foam and our second, this is our overlay. So you're going to go ahead and get your foam and place it in the wound. It's okay if it's a little bit larger because you'll see why. The second layer that I'm going to put is actually going to go right above it, and the suction is going to take care of the excess. This is the part that's really tricky, especially if there's only one person. One hand you want to hold it down, but the other hand you want to go ahead and place that overlay without any leaks. So let's go ahead and hold that in place, and same thing, I recommend starting from one side and make sure it's cut nearly at the same size as you can as the barrier. Remember, the barriers are protective, so it's protecting from the second layer. And we can fix this as we go along. Okay, this is the part that's the hardest, but as long as I can get that to stick, I can work out everything else. All right, so far so good. That edge is good. And we can work on the other side. And we are in business. Now that it's secure, I can go ahead and continue with removing these parts, the excess. All right. Now we're going to remove this from the other side. Same thing, remove the tape and just sort of work it down at the same time so you don't get any air trapped in there. Okay. And of course we can always fix it as needed, but so far so good. And of course on an actual human, it'd be a little bit easier to see air bubbles. So yeah. All right, you guys, we're towards the final step of the dressing change. We're gonna go ahead and apply the suction tubing to the actual foam itself. So first and foremost, you wanna cut a hole into not necessarily the foam. It's okay if you cut into the foam a little bit, but the main thing is you wanna cut the top layer of the tape. So that way, this part can actually adhere and create the suction. And for sizing, generally you're gonna have a wound that's a lot larger than this. This wouldn't be treated with the wound VAC. But in our situation, you wanna make sure that the hole is at least the size of this inner part so that the suction can adhere. So let's go ahead and start by cutting that. You wanna grab this with your forefingers and your thumb, making sure not to injure your patient, of course. And not to chop off your own fingers at the same time. I feel like that's a pretty good size, enough to create the suction, but also you've got a little bit on the edges so your foam doesn't come out. So at this point, you've got your tubing. So your tubing is going to be connected. You can remove number one. You want to make sure the inner surface is right above the wound for it to create a good suction. And once it's there, just press it down and work out any air that you have. The good thing is you can always go back and fix it. So you can get any leaks out. Once you've got that first part out, you can take off number two. All right, and lastly, number 3, which is always the blue tubing, or the blue portion of the tape. All right, your dressing looks good. You can go ahead and connect the other portion of the tubing to the machine and set your pressure, which is generally set to 125. You want to make sure you are unclamped, which in this case we are. And that's going to go ahead and create a suction. Sometimes it takes up to 10 seconds. Just make sure you're at the appropriate pressure. If not, you can go ahead and troubleshoot right away. You should have plenty of extra tape. If you have a leak, you can reinforce the edges here or wherever you need. All right, you guys, that concludes our wound vac dressing change. Just go ahead and make sure to document how many pieces of foam were inserted at the time of dressing change, as well as how the patient tolerated the procedure.